welcome to the 223rd day of the Swasthya 365 Days project. Today's topic is bladder cancer. Bladder cancer starts when cells that make up the urinary bladder start to grow out of control. As more cells develop, they can form a tumor with time and spread to other parts of the body. The bladder is a hollow organ located in the lower pelvis. It is flexible, muscular walls that can stretch to hold urine and squeeze it out of the body. Bladder's main job is to store urine. Urine is a liquid waste made by the two kidneys and then carried to the bladder by the two ureters. When you urinate, the muscles of the bladder contract, that's called as detrusor muscle. The urine is forced out of the bladder to the tube called as urethra. Now we are going to see about the types of bladder cancer. Urothelial carcinoma or transitional cell carcinoma. Urothelial carcinoma, also called as transitional cell carcinoma, often abbreviated as TCC, is by far the most common type of the blood cancer. These cancers start in the urothelial cells that is inside of the bladder. Urothelial cells also line the parts of the urinary tract such as part of kidney that connects ureter called as renal pelvis and the urethra. People with bladder cancer sometimes have tumors in these places too. So all urinary tracts need to be checked for tumors. The other types of bladder cancer. Other types of cancer start in the bladder, but these are all much less common than the urothelial transitional cell cancer. Squamous cell carcinoma. In the US, only about 1% to 2% of bladder cancers are squamous cell carcinoma. Seen within the microscope, the cell looks as much flat like that are found on the surface of the skin. Nearly, the squamous cell carcinoma of the bladder are invasive. Adenocarcinoma. Only about 1% of the bladder cancers are adenocarcinoma. These cancer cells have a lot in common with the gland forming of the colon cancers. Nearly all adenocarcinoma of the bladder are invasive. Small cell carcinoma. Less than 1% of bladder cancer is small cell carcinomas. They start in the nerve-like cells called as neuroendocrine cells. These cancers often grow quickly and usually need to be treated with chemotherapy. Sarcoma. Sarcoma start in the muscles of the bladder, but they are very rare. These common types of bladder cancer other than sarcoma are treated a lot like TCCs, especially in the early stage of tumors. But if chemotherapy is needed, different drugs might be used. Start and spread of bladder cancer. The wall of bladder has several layers. Each layer is made up of different kinds of cells. Most bladder cancers are the innermost lining of the bladder, which is called as urothelium or transitional epithelium. As the cancer grows into the other layers in the bladder wall, it has a higher stage, it becomes more advanced and harder to treat it. Over time, the cancer grows outside the bladder into the nearby structures. It may spread to the nearby lymph nodes or to the other parts of the body. In medical term, we call it as infiltration. When bladder cancer, it tends to go to distant lymph nodes, bones, lungs or liver. Invasive versus non-invasive bladder cancer. Bladder cancer are often described based on how far they have spread into the wall of the bladder. Non-invasive cancers are only in the inner layers of cells, that is in the transition epithelium. They do not go into the deep layers. The invasive cancers have grown the deep layers of the bladder wall. These cancers are more likely to spread and harder to treat. As a bladder cancer can also be described superficial or non-muscle invasive. These terms include both non-invasive tumors as well as invasive tumors, but have not grown into the main muscle layer of the bladder. Papillary versus flat cancer. Bladder cancers also divide into two subtypes, papillary, flat, based on how they grow. Papillary carcinomas, flat carcinomas. Papillary carcinomas grow in slender, finger-like projections from the inner surface of the bladder towards the hollow center. Papillary tumors often grow towards the center of the bladder without growing in the deeper bladder layers. These tumors are called as non-invasive papillary cancers. Very low grade, slow grading. Non-invasive papillary cancer is sometimes called papillary urothelial neoplasm of non-malignant potential, often abbreviated as PUN-LMP, and tends to grow and very good outcome. Flat carcinomas do not grow towards the hollow part of the bladder at all. It is a flat cancer. It is grown in the inner layer of the bladder cells. It is non-invasive flat carcinoma and the flat carcinoma is in situ, CIS. If either papillary or flat tumor grows in the deepest layers of bladder, it is called as invasive urothelial or transitional carcinoma. How common is bladder cancer? In American Cancer Society estimates the bladder cancer in the United States for 2021 are about 83,730 newer cases of bladder cancer and about 17,200 deaths from bladder cancer have been reported. Rates of the new bladder cancers and death linked to the bladder cancer have been dropping slightly in the women in recent years. In men, indicates rates have been decreasing, but death rates have been stable. Bladder cancer is the fourth most cancer in men and but less common cancer in women. Risk of bladder cancer. Bladder cancer are mainly in older people. About 9 out of 10 people with this cancer are over the age of 55. The average people of the age is diagnosed is 73. Overall, the chance men to develop the bladder cancer of life is about 1 in 27. For women, it's 1 in 89. Whites are more likely to be diagnosed with bladder cancer, and the African Americans or Hispanic Americans are not. Other cancer, chronic bladder inflammation. If you have a bladder inflammation, then keep back your another condition that causes your bladder to be irritated for long periods of time. You have a bigger risk of getting a bladder cancer. Next is smoking. Every time you use tobacco fumes, you are taking in all kinds of harmful chemicals. Researchers show that smoking is cause of 50% of all bladder cancers. Working around harmful chemicals. People who work in chemical industries such as painters, mechanics, printers, hairdressers, truck drivers, among others, are exposed to harmful chemicals can have a risk of getting a bladder cancer. Taking certain diabetes medications. If you have pioglitazone for more than 1 year, you may stand a greater chance of getting a bladder cancer. Prior chemo and radiation treatment. If you have radiation therapy your pelvis, you are more likely to develop a bladder cancer. The same is true if you have taken with cyclophosphamide for a long time. Thank you.